Thanks, dear viewers, for joining us on this edition of the Primetime Newscast on Equinoxe Television, live from my headquarters in Cameroon's economic capital, Douala. The President of the Republic of Cameroon, Paul Biya, takes a series of measures to mitigate the devastating impact of the fight against COVID-19 on the economy and businesses in the country. We shall be giving you details in this newscast. And the President of the Progressive Movement political party, Jean-Jacques Ekindi, resigns from his political party to join the CPDM. Those were our top stories. Thanks, ladies and gentlemen, for joining us on this edition of the news, live from my headquarters in Cameroon's economic capital, Douala. I am Bable Jonathan. We begin in politics, and he was one of the fervent and tough critics of the regime in the Republic of Cameroon. He was once an opposition leader, Honorable Jean-Jacques Ekindi, former member of parliament and now former president of the Progressive Movement political party, announced his resignation from the party that he has been leading for decades today, and he is joining the ranks of the ruling Cameroon People's Democratic Movement CPDM political party. And during the press conference today in Douala, he highlighted the difficult socio-economic and security situation of Cameroon today and the failure of the opposition. Details with Innocent.
Founder and president of the Progressive Movement Party, Jean-Jacques Ekindi, resigns from his party to join President Paul Biya's Cameroon People's Democratic Movement, CPDM, a decision from a thorough rethink.
Not very far from the end, you have to ask your question, what have I done, and what is remaining to be done? And I came to a position where in the political opposition now, quite nothing is done. Quite nothing is done, and all the decisions are taken elsewhere. And I believe that I have to go where decisions are made, and where decisions are made in CPDM. I may be wrong, I may mistake, but let's at least go for this experience and see how things will be taken.
His plunge into the CPDM, according to him, is also instigated by CPDM's readiness to seek solutions to challenges faced by Cameroonians, like the present health crisis and the socio-political impasse in Anglophone Cameroon.
We are talking about the Nozo fight. We must go deep in solution. We cannot stay in the fact that somebody is saying this, some others are saying that. As I said last time, we must take advantage of this ceasefire in order to come to a real peace. But this has to be undertaken. I believe that going inside CPDM, what I'll be saying will be taken in consideration as part of solutions we are looking for. And let everybody know that I'm not there to fight anybody. I'm not there to look for any position, but to see what we can do in order to find a real solution.
Jean-Jacques Ekindi equally said a meeting will be held in the coming days with militants of the Progressive Movement Party to discuss the party's future in his absence or foresee its possible dissolution.
Dockers at the Douala seaport once more took to the streets today in the country's political capital, Yaoundé, in the country's economic capital, Douala, and they are protesting against several problems plaguing their activities, and they are asking the management of the institution to provide solutions to their plight immediately, or they will continue on the streets. Details in this report compiled by Smanjik and Gabriel.
Dockers of the Douala seaport have dropped their tools again to ask for better working conditions.
Dockers and Paul on Douala, they are in problem. The problem is that the convention, who the government signed, the government will not respect the convention. And Dockers, they are asking that the convention must be applicated. If the convention is not applicated, no work. That is what we said.
The dockers, who are on a peaceful demonstration, are requesting for the following things to be done before they can go back to work.
On souffre trop, vous comprenez non?
We are suffering a lot here. We don't have labor warranty, which we had before, but now cancelled. At first, we were in a syndicate, but now we've changed to an association. We don't have a working contract. The money he was supposed to give hasn't been paid. Apart from getting better working condition, the dockers also want the departure of the director of the Cameroon Dockers Service, CDS, the enterprise taking care of the well-being of the dockers. The angry workers say he is hiding behind coronavirus to carry out his plans.
Il profite derrière corona.
They are hiding behind the corona epidemic to cancel our bonuses.
On n'a plus besoin de lui.
The presence of the security officials from the mobile intervention unit of the police force in Douala was noticed. The dockers say government should act fast, without which the offloading and loading of ships will be grounded.
Now on coronavirus news, beer parlors and other entertainment sites will go operational after 6 p.m. again, and transport restrictions that were imposed by the Ministry of Transport within the framework of the fight against the COVID-19 pandemic have been lifted. These are some of the 19 measures taken by the President of the Republic of Cameroon today to mitigate the impact of the fight against COVID-19 on the economy and businesses. And this is coming after a study has been rounded up on the impact of COVID-19 on the country's economy. Take a listen to Prime Minister Chief Dr. Joseph Jangote, who announced the measures today.
President of the Republic, His Excellency Paul Biya, prescribed 13 measures to limit and control the spread of this pandemic in our country. On 9 April, additional measures were prescribed, including the compulsory wearing of protective masks in all areas open to the public. Given the rate at which this pandemic was spreading in our country, the President of the Republic on 2 occasions extended the restrictive measures taken on 17th March and 9th April for a renewable period of 15 days. Although these measures are difficult, they are necessary to ensure the protection of all and to limit the spread of COVID-19 in our country. These measures have created economic and social distortions whose effects are being felt in several areas of activity. The most concerned are undoubtedly the transport, hotel, and catering sectors. In short, trade in general. Faced with this situation, the head of state instructed the government to conduct a study to assess the impact of COVID-19 on the national economy and to determine the accompanying measures to be implemented to support sectors in difficulty as well as households that are most in need. To implement this instruction, the study was carried out following a participatory approach in conjunction with the private sector and technical and financial partners. In addition, weekly meetings to evaluate the implementation of COVID-19 response strategy have revealed that the actions taken by the government to contain this pandemic are beginning to bear fruit. Although screening tests reveal new cases of coronavirus positive patients, the number of people declared healed of this disease in our country has been on the rise. Furthermore, the mortality rate from this virus remains low compared to the number of positive cases. Considering the encouraging results observed in the implementation of the COVID-19 response strategy in Cameroon and the conclusions of the study on the socioeconomic impact of this pandemic on our economy, the President of the Republic, His Excellency Paul Biya, has decided the following easing and support measures in order to relieve the sectors hard hit by this health crisis. 1. The opening after 6 p.m. of bars, restaurants, and leisure facilities with the obligation for customers and users to respect barrier measures, in particular the wearing of protective masks and social distancing. 2. The lifting of the measure reducing the mandatory number of passengers in all public transport by bus and taxi. The wearing of masks remains compulsory and overloading is prohibited. 3. The suspension for the second quarter of 2020 of general accounting audits except in cases of suspected tax evasion. 4. The postponement of the deadline for filing statistical and tax declarations without penalties in case of payment of the corresponding balance. 5. The granting of moratorium and deferrals of payment to companies directly affected by the crisis, hence suspending forced recovery measures against them. 6. Supporting the finances of companies through the allocation of a special envelope of 25 billion CFA francs for the clearance of stocks of VAT credits awaiting reimbursement. 7. The postponement of the deadline to pay land taxes for the 2020 financial year to 30th September 2020. 8. Full deductibility to determine the corporate income tax of donations and gifts made by companies for the fight against COVID-19 pandemic. 9. The exemption from the tourist tax in the hotel and catering sectors for the rest of the 2020 financial year as from March. 10. Exemption from the withholding tax and from parking fees for taxis and motorbikes, as well as from the axle tax from the second quarter. This measure could be extended to the rest of 2020. 11. Exemption for the second quarter from the withholding tax and council taxes, market duties, etc. for petty traders such as buyers and sellers. 12. The temporary suspension for a period of 3 months of the payment of parking and demurrage charges in the Douala and Kribi ports for essential goods. 13. The establishment of a Ministry of Finance mini-part consultation framework with the main economic actors in order to mitigate the effects of the crisis and promote a rapid resumption of activity. 14. The suspension for a period of 3 months, that is, April, May, and June, of on-site inspections by the National Insurance Fund. 15. The cancellation of penalties for late payment of Social Security contributions due to the National Insurance Fund upon reasoned request. 16. Spreading the payment of the Social Security contributions for the months of April, May, and June 2020 over 3 installments upon reasoned request. 17. The maintenance for the next 3 months, that is, from May to July, of the payment of family allowances to staff of companies which are unable to pay Social Security contributions or which have placed their staff on technical leave because of the economic downturn, particularly in the catering, hotel, and transport sectors. 18. The increase of family allowance from 2,800 CFA to 4,500 CFA. 19. The 20% increase of old age pensions that were not automatically re-evaluated after the 2016 reform. In addition, the President of the Republic has decided to extend the measures taken on 17th March 2020 as part of the COVID-19 pandemic response strategy for an additional 15-day period, renewable if necessary. In conclusion, I urge the population to continue to strictly observe the barrier measures and all measures aimed at limiting the spread of the coronavirus in our country, in particular the systematic wearing of protective masks in all areas open to the public and the prohibition of gatherings. I also call on public workers who have abandoned their duty post under the pretext of confinement to COVID-19 to return without delay to their places of work, failing which they will be subject to the disciplinary sanctions provided for by the regulations in force. Minister.
Cameroon's Prime Minister, Chief Dr. Joseph Dion Gute, announcing the measures taken by the President of the Republic to mitigate the economic impact of the fight against COVID-19. And at the tail end of that declaration of the Prime Minister, he urged all civil servants who have been absent at their duty posts to go back to work or will be sanctioned, or they will be sanctioned. Now to the Indian division in the southwest region of the Republic of Cameroon. Authorities, notably administrative and health authorities, are urging government to beef up their division's capacity of response to the COVID-19. Derek Jato files in details.
While hoping for the best, it is important to prepare for the worst. Can Indian division fight back in any way if a coronavirus case penetrates here? The division is in need of health personnel and equipment.
Indian has its own specificity, and that is why I'm calling on the powers that be to ask our medical personnel in Indian division to also see into it that some medical structures are implemented.
And at the level of implementing the government preventive measures, Forwan Lawrence, the senior divisional officer for the Indian division, says the outcome of evaluation meetings indicate that Indian division is stable.
I think for now we are very, very well protected. The population of Indian has taken an oath to respect all the 20 measures for their own well-being and for the well-being of everybody in Cameroon.
This is because all the stakeholders have come on board to fight the common enemy, the coronavirus. From Ekondo Titi to Toko, the Komebalu to Bakasi, cutting across the Center Mundimba, Council's actions have been laudable in the fight.
I want to say that I'm very, very happy with the intervention of the various stakeholders who were here present. I also take this advantage to thank all the forces of law and order who have been doing a wonderful work on the field to ensure that the 20 measures are implemented.
And Chief Dr. Joseph Dion Gute, the Cameroon Prime Minister and Head of Government, an elite and traditional ruler of Indian division, has also contributed to support his division in this battle. But this division that shares a long and porous border with Nigeria don't even have one thermoflash to begin with.
And we need also thermoflash in Indian division. We should not forget that we share a long porous border with our neighbor, the Federal Republic of Nigeria.
How then can basic checks be carried out, especially at the borders with Nigeria? The question remains unanswered, and the population of Indian division wants something to be done now if we are all looking in the same direction in this fight against coronavirus.
The southwest region has received its own share of President Paul Biya's close to 2 billion francs CFA COVID-19 aid. The anti-COVID-19 materials left the nation's political capital Yaoundé yesterday for the 10 regions of the country, and Governor Bernard Ukale-Bilai of the southwest region received the share of the southwest at the governor's office yesterday, and the COVID-19 material will be dispatched to the subdivisions of the region and will be shared to the population according to government authorities. Now take a listen to Governor Bernard Ukale-Bilai. Greater details in this extract.
The special assistance to the population of the Southwest region from the head of state. It has been announced by the Minister of Territorial Administration. Those trucks, some are still on their way coming. They will go right to the various, all the 6th division and the 81 subdivisions, and commissions have been put in place to make sure that the grassroots population will receive those items for the fight against coronavirus in the Southwest.
From the southwest to Lum in the Mongo Division littoral region of the Republic of Cameroon, where children are not still respecting the measures taken by governments to prevent the spread of COVID-19 in the country. In one of the 13 measures taken by the government of the Republic of Cameroon, there was the shutting down of schools, and children asked to stay back at home in order to keep them safe, keep them from contracting COVID-19. But in the streets of Lum, many children are seen hawking different items. Details with Immaculate Fogwe and Jacques Inomolo.
There are reasons to be concerned by the prolonged school closure in Cameroon, as child street hawking has now become a common phenomenon. Here in Lum, Mongo Division of the littoral region, children within the age range of 5 to 15 are seen selling different items such as second-hand clothes, fresh tomatoes and bottles of water, hence violating the confinement measure taken by the government of Cameroon on the 17th of March. Poverty and the worsening economic situation has been blamed for the action. Immediately as schools were closed, we have been helping our mother to sell in the market, go to the farm and work at home. We have no choice than to sell so as to have what to eat. I used to come to the roadside to help mom with her cold box business. I am so scared of the coronavirus because it is invisible and it kills. At a time when the number of positive COVID-19 cases keeps on increasing in Cameroon, parents are called upon to keep their kids at home. I am calling on parents to keep their children at home. When I see them walking around on the streets, I'm really bothered because they can easily be infected. It is deplorable that these children are rather found on the streets. We wish that their parents can respect the measures taken by the government of Cameroon. In response to the coronavirus outbreak in Cameroon, the government of Cameroon on the 17th of March 2020 ordered for a nationwide school closure as an emergency measure to prevent the spread of the virus. The governor of the southwest region, Benau Kalabilai, in a recent outing, had warned that parents whose kids will be caught hawking in the market will be arrested.
Still in Lum in the Mongo Division of the littoral region of Cameroon, insecurity is on the rise with all the restrictive measures imposed by administrative authorities within the context of the fight against COVID-19 in the country. Inhabitants of Lum say insecurity is at its peak, and with schools and businesses closed as a measure to fight COVID-19, men of the underworld are said to have increased their tax on the population. Details with Fomi Armstrong Sander.
A crowd of mourners in front of the Lum District Hospital in the Mongo Division of the littoral region of Cameroon. They are attracted by a butchered, lifeless body placed directly at the way into the hospital. The corpse has been identified as Kiven, a 22-year-old secondary school student in the town of Lum. He took advantage of the school closure in Cameroon to dash into the commercial motorbike sector, where he will finally meet his doom. According to his mother, Kiven was fine and healthy when he left the house until the shocking news of his death. His brother James says Kiven was murdered by unknown individuals who took away his commercial motorcycle. He continued that Kiven's dead body was discovered by passers-by along one of the streets in Lum with a deep hole on his back. An assertion confirmed by Kiven's best friend, who added that Kiven was not the proprietor of the motorcycle but got killed by individuals who wanted it.
So we don't really know the route way past, but all we know now say that secure the whole the key, they take the machine.
The event took place at night but brought in security and medical officials the next day. Dr. Titsa Ledoux of the Loom District Hospital says preliminary examinations shows that Kiven was stabbed to death. Inhabitants of the town of Loom, like those of the rest of the Mungo division of the littoral region of Cameroon, say insecurity has been on the rise in the area since the implementation of some of the special measures to fight COVID-19 by the governments of Cameroon.
The International Labour Organization has said nearly half of the world's workers risk losing their livelihoods over COVID-19 lockdowns, and the ILO estimates that 1.6 billion people are in severe danger of losing between 60 to 80% of their income sources. And in the following extract, take a listen to the Director General of the International Labour Organization, Guy Ryder.
Formal economy is a place where, in fact, 6 out of 10 workers in the world make their living, and they make their living beyond the reach of labour legislation, beyond the coverage of social protection. The normal laws, the rules that many of us take for granted simply don't apply. And therefore, these are amongst the most vulnerable, the most exposed people in the world to the social and economic impact of the pandemic. And of those 2 billion people, our report launched today indicates that 1.6 billion are really in severe danger of massive disruption of their livelihoods. The aggregate figure is for a fall in their income, the income of these workers, of some 60%, going up to over 80% in Africa and in the Americas. So this is the real sharp-edged drama of the pandemic. We think that in the second quarter of this year we'll be down to a level of working hours equivalent to the loss of 305 million jobs worldwide. Compare that to the estimate we put out just 3 weeks ago. The corresponding figure then was only 195 million jobs. So that indicates we're still in a period of net job disruption. We haven't hit the bottom of this situation yet. As we speak, 68% of workers in the world are in countries under mandatory or recommended lockdowns of one nature or another. So the answer to your question, and we can't put dates to it, is, when these lockdowns begin to be lifted, when people start getting back to work, then I think we could expect some fairly quick improvements in these dramatic figures.
Talking Point is up next. Our guest today is joining us from Minnesota, United States of America. Dr. Dieter is an associate professor, joining us, an assistant professor, joining us from the United States of America, and he is a consultant gastroenterologist and hepatologist, Regions Hospital, St. Paul, Minnesota. Doctor, you're welcome.
Thank you very much, Mr. Babila, for the invitation. I want to use the opportunity to thank all your televiewers, whom I know are found worldwide, and I look forward to having a discussion with you that can help our people as regards the COVID ongoing pandemic.
You're an assistant professor of medicine at the University of Minnesota and University of Minnesota Medical School, is that?
Yes, Babila, I'm currently an assistant professor of medicine at the University of Minnesota Medical School. I'm also a consultant gastroenterologist and hepatologist working at the Regions Hospital in St. Paul, Minnesota. I've been out here working with the university for close to 4 years now.
All right, you're joining us from Woodbury, Minnesota State. What's the situation where you are as far as COVID-19 is concerned?
Yeah, Babila, thank you so much again for that question. Of course, we know that the COVID pandemic hasn't spared any part of the world. We have all seen the images on TV, how it's ravaging all over the world. In the United States, we know New York was the hardest hit, but where I am based in Minnesota, so far as of yesterday, about 4,700 individuals have been diagnosed with COVID-19. We've had about 320 deaths and about 320 people who are currently hospitalized. As regards the entire United States, of course, we've now gone over 1 million people who have been infected by this virus, and we've recorded 61,000 deaths. So this is really one of those moments that we never thought we would be talking about in our lifetime. And I think all of us need to pay attention to, and hopefully we will talk about COVID-19 and how we can help our people back home in Cameroon.
Right. Let's talk about other Cameroonians and blacks in the United States of America. The information reaching us indicates that they are among the majority of COVID-19 death victims. Is that still the case?
Yes, Babila, that is the case. That's the shortest response to your question. Mr. Babila, as I would like your televiewers to know, that worldwide, it's not a new finding that individuals in the low socioeconomic status often had hit by such pandemics. That is not different in the United States. It's true that the United States is one of the biggest economies in the world, but we still observe a lot of disparities as it pertains to racial, ethnic divisions. One of the main factors that we know drives mortality in COVID-19 has been existing comorbidities. And we know that blacks are so affected and have a lot of comorbidities compared to the other racial groups, which is what we think is driving this high mortality in this population. They are more likely to have chronic lung diseases, heart failure, more likely to be homeless, and perhaps those are the factors that are driving the high mortality that we see in individuals with COVID-19. So yes, minorities and blacks are heavily affected, but this only highlights the racial disparities that are usually observed when it comes to health care outcomes in the United States.
If I may ask you, what explains that disparity? Is it just a question of race, or there are other socioeconomic factors that favor the existence of this disparity, of this gap between the whites and the blacks when it comes to health issues?
Yeah, and that's true. Again, if you follow the last segment, the last point I just made, in the United States, we know that there are racial disparities as relates to healthcare outcomes. We know that the blacks are more likely to have the chronic medical conditions which we know are driving mortality among patients that are affected by the COVID-19. As I cited a few examples to you. It is not really because they are black as such, but it is because they are in the lowest socioeconomic level status, and that they have a majority of them have those comorbidities, which we know are directly related to mortality. That's exactly the reason. It's not related to things like if a black comes into a hospital, are they treated differently from a white person as relates to COVID-19? Probably not, and I think that's not the situation. But it is primarily by the fact that they're already coming in with other underlying medical conditions, which we know are the direct and main drivers of mortality as relates to COVID-19.
Dr. Dita, what do you think about the COVID-19 situation of your home country, Cameroon?
Yes, again, very important because in fact, each time I go to bed, I always think about my home country, and I've been very worried given this ongoing situation. As you know, the socioeconomic status of our people back home is not the best. I mean, even if you were to compare them to blacks in the United States, we will agree that the blacks out here are still doing much more better compared to our people back home. So if that's the main factor that is driving mortality, it is therefore very important that we in Cameroon focus on the preventive measures rather than try to think whether we can treat this problem or not. If you don't have the infection, you are not at risk of these outcomes that we are talking about. So I know the government has come out with a lot of measures, which I really applaud, because I think if those measures were implemented as they are supposed to be, then the situation in Cameroon will probably not get as bad as it has gotten in other countries like Spain, Italy, or in the United States. But one caveat has been that these measures were prescribed without accompanying socioeconomic measures. I mean, these are people whose livelihoods depend on day-to-day activities. I mean, you have somebody who is driving his bike, he goes out, he gets a bit of money, he has to buy food, come home and feed his family. And when you ask him not to go out without telling him how he's going to feed his family, that gets really very difficult to follow. So in this newscast, I just heard you announce certain measures from the Prime Minister, which are meant to perhaps mitigate the socio-economic impact of this virus on our people. And I am hopeful that they begin to help, because otherwise it is very difficult to see how Cameroonians will follow those measures as prescribed by the government. So again, my take-home message is, let's focus on prevention. That's what will help us. And it turns out that, again, this is anecdotal, but it's been discussed even in the biggest medical bodies, that the weather is certainly playing a big role as to the spread of COVID-19. Perhaps, as my people say in Pidgin, a cow where you no get fly, where you no get tail, now God will drive the flies. I am thinking that God is driving the flies of Cameroonians, and the weather may be something that will help us a lot to see that we do not arrive the proportions that we see in other countries as relates to COVID-19.
Now, according to one of the measures taken by governments to mitigate the socio-economic impact of the fight against COVID-19 is the reopening of bars or beer parlors and other entertainment sites after 6 p.m. These places will be functioning again after 6 p.m. on the condition that they will respect all the sanitation rules of the World Health Organization, social distancing and other rules that are to be respected. What do you think about this particular measure? Is it going to help? Is there any danger of this measure contributing in the propagation or the spreading of COVID-19?
Yes, I think there are certainly some dangers, but these measures certainly need to be balanced as relates to the Cameroonian context. If you have been listening to international news, you probably hear that in the United Kingdom this week, there was a hike of about 10% in terms of mobility on the roads, meaning that as time has gone on, people have been asked to sit down, people have been asked not to go out and work. It's becoming a bit very difficult for people to keep to those measures. So the more time we have these strict restrictive measures in place, people will begin to agitate and they will want to come out. And any measure to relieve these restrictive measures will depend on the COVID situation of every country. And if I listen to the newscast very well, it looks like the Prime Minister and the government is convinced that we are getting to a point where the fear that they had in terms of how the disease will spread is not as they initially thought. So they believe that perhaps beginning to alleviate some of these measures may be needed. In the United States, I can tell you that there are a handful of states which are beginning to loosen the restrictive measures. But they still have certain of those measures in place. For example, you must have the mask on when you go out to these places. They've redesigned the workplace in a way that people will continue to maintain social distancing. As people come to work, they're measuring their temperatures, they're asking for signs and symptoms, such that if there is any suspicion, then those patients will not be allowed to come into the workplace. And we know that, again, mortality in this disease is primarily in the older individuals. So measures can be directed to address that specific group of the population. For example, in the United States, people think that the youths who are affected least by this virus and who die in a very small proportion may be able to come out and go about their activities, but the most at-risk population, which include the older individuals or immunocompromised patients, should perhaps continue to follow these restrictive measures as staying indoors, not coming out unless absolutely necessary. And in that way, we can begin to reopen the economy. We cannot underestimate the impact of these restrictive measures when it comes to the economy. Me, I am a physician, and I can tell you, my salary has been cut by 30% just because of the impact of COVID-19. A lot of my nurses have been furloughed, they've been laid off because of this. And as you may have heard in the news, the number of individuals applying for unemployment benefits in the United States has risen to its all-time high. So again, while we are fighting the virus, we have to think about its socioeconomic impact on the population and find means by which we can reopen the economy or the country in a way that is safe. And that can only be dictated by the situation on the ground.
Dr. Odita, what do you think, or what is your take on the African traditional medicine solution to COVID-19? The Archbishop of the Douala Metropolitan Archdiocese of the Roman Catholic Church, His Grace Samuel Kleda, says that his mixture of herbs against COVID-19 is very effective, and all the patients who were administered that treatment recovered their health.
Yeah, Mr. Babila, I mean, I know the news in Cameroon has been dominated lately by the announcement made by the Archbishop. I mean, it's no news that I was born in Mancon, in a small quarter called Ntakmafe, and my parents and our culture as Cameroonians has for a very long time been founded on traditional medicine. And a lot of times when we had a fever, when we had diarrhea, our parents sometimes simply went to the backyard, harvested some leaves, and came and gave us, and we would be surprised that in 2 days we were up and running around. So we cannot be dismissive of what the Archbishop is saying. However, from a scientific standpoint, there are certainly questions that can be asked about the effectiveness of what the Archbishop is saying. I am very happy to hear that the Cameroon government, the Ministry of Scientific Research or so, may be getting in touch with the Archbishop to work out a plan on how they can show scientifically that this medication works. In medicine, we know to show that the Archbishop's medicine is certainly working, we will need to carry out what we call a randomized control trial, meaning we get subjects that are all infected by the virus. We divided them into 2 arms. We give the medicine to one arm, we do not give to the other arm, and after a certain amount of time, we come and see how those patients say. We measure their outcomes in terms of how rapidly do they recover, or how many die in this arm as compared to the other arm. In the absence of such information, it will be very difficult for the Archbishop to make his case to the international community that his medication is working. But again, I am a Cameroonian, I am an African. We say in Cameroon, in Pidgin, that or in English, that it is only he that puts on the shoe that knows where it hurts. So if you came down with this virus and you had no other option, you will be making that personal decision. And if the only option you had available to you is what the Archbishop is proposing, if I were in that position, I am going to take it. Because this is an evolving pandemic. We cannot begin to stress on all the scientific evidence that we need to prove that something works when people are dying. If there was an alternative, then that has been proven to work, then we will all turn to that alternative.
All right, Dr.
But in the absence of
Adita.
that alternative, if I were president.
All right, in something like 30 seconds before we go, the Minister of Public Health of Cameroon, Dr. Manauda Malachi, has decided to prohibit the use of scanners to test COVID-19, and persons have been asked to pay up to 60 to 70, 90, even 100,000 francs yearly in some hospitals for the COVID-19 test through the scanner, notably with regards to the scarcity of tests in Cameroon and other parts of the world. What do you think about this decision? Is it a good decision at this point in time?
Well, Babila, I saw the notice that was put out by the Minister of Health yesterday. If I read it very well, the minister was saying that CT scans cannot be used as a confirmatory test for COVID-19. What I disagree, I agree with the fact that a CT scan is not what we use to confirm whether a patient has COVID-19 or not. The test is a real-time transcriptase polymerase chain reaction test. So far, the antibody test is not performing as well. That test remains the only test to show that a patient has COVID-19. However, I disagree that the minister dictates what they should do when they are faced with the patient. They make decisions based on the patient's ongoing situation. If a COVID-19 patient has been admitted and his scan further evaluated whether the patient has developed some complications that require another intervention, that should happen. But to simply say they cannot use a CT scan.
All right, Dr. Ivor Dita, you're an assistant professor of medicine at the University of Minnesota Medical School, consultant gastroenterologist and hepatologist, regional hospitals, St. Paul, Minnesota. Thanks for joining us in this edition of the 6 p.m. primetime news on Equinoxe Television from Woodbury.
Yeah, thank you, Mr. Babila, again for inviting me. I am an avid listener to Équinoxe TV. I really want to appreciate the work you guys are doing in Cameroon to inform the population. And please do not hesitate to come back anytime if you need my assistance. Thank you very much.
Thank you, Doctor. Thanks, ladies and gentlemen, for staying with us. That's it for today.